In the United States, most physicians are paid through a fee-for-service model, which values the volume of services provided as opposed to the outcomes, efficiency, effectiveness, or equity of that care. And so what we have seen over the last 10 to 20 years is a real shift and considerable innovation on the part of plans around the country to move physicians from fee-for-service to alternative payment models. They're often called value-based payment models or outcomes-based payment models. The impact of these has been to create a business case for clinicians to make the investments that are needed to really take care of patients at the population level, to move from simply taking care of patients in the visits when patients come in, but to think programmatically about the types of interventions we'd be wanting to do for patients, whether they're in the clinic or not. Now, the reason this has taken 10 to 20 years of progress and that there's still work to be done is that technically this is hard. When you consider moving away from volume, you have to figure out what should payment be based on. And so there's a long conversation about what measures should be used, and those are often negotiated between the health plan and providers. And then once you've established the measures, what should the targets be? And as you can imagine, those can be really complicated and long conversations. All of that said, if you look around the country, many health plans have made considerable progress in moving, in particular, primary care physicians towards these new outcomes-based models. In terms of the challenges that still need to be addressed, one thing we see is that there's been limited progress in terms of specialist care, where most specialists in the U.S. are still on a fee-for-service or volume-based payment, which is really important because quite a bit of healthcare cost and very serious illness and some of the more stressful experiences occur in specialty care. And so that's an area we think about a lot. And we also see varying degrees of compensation change, meaning that we can establish, a health plan and a provider can establish a outcomes-based contract at a practice level, but then it's up to the practice to translate those incentives into individual compensation programs that reward physicians and their care teams for improvements in outcomes and efficiency.